Hi, I'm Casey, and I'm a certified hand therapist. I've been a therapist for over 13 years, and I've treated thousands of patients with pain in their hand, wrist, elbow, and even shoulder. I'm here to help. I'm your hand coach. Hello and welcome to Hand Coach. In this course, you will be learning what cubital tunnel syndrome is, what the common symptoms are, and what you can do about it at home. Cubital tunnel is commonly called the funny bone, and it's located on the inside of your elbow. It houses the ulnar nerve. When the ulnar nerve gets irritated at this location, it's referred to as cubital tunnel syndrome. Nerves that go out to your hand function like a garden hose. They leave the neck, cross the shoulders, travel down the arm, and then split into 3 differentiated nerves. The ulnar nerve is the one that we are concerned with today. It feeds the sensation of the small finger and ring finger and powers the strength of the hand and thumb. Just like a hose, if anywhere along the nerve gets compressed or kinked from inflammation or through mechanical compression, the end result will be the same. Numbness and tingling of the small finger, ring finger, and weakness of the hand. Of the thousands of patients that I've seen, there are some typical symptoms that present. Numbness and tingling of the small finger, ring finger, achiness or cramping of the forearm, buzzing or tingling, feelings of ants crawling on the skin, pain in the elbow. Over time, this can lead to loss of grip, decreased coordination, as in inability to write, type, or even button, and a loss of what we call intrinsic musculature, or the muscles in between the metacarpal bones of your hand that give it a normal appearance. As a certified hand therapist, we focus on decreasing and finding the root causes of the irritation and aggravating activities contributing to your symptoms. This will reduce symptoms by allowing the nerve to recover without constant irritation or injury upon it. Of course, there are certain situations wherein the nerve has been compressed or irritated for so long or so badly that healing is not possible. In this situation, a board-certified hand surgeon consultation would be the next avenue to explore. They can either do a decompression or removing the underlying tissue that is squeezing the nerve, or sometimes they can actually move the nerve to a different location to allow a little more slack and thereby allowing recovery to happen more easily. A qualified hand surgeon will be able to accurately diagnose and determine the most appropriate intervention if you get to this stage. A nerve conduction study can be helpful in identifying and locating the severity of the condition and the exact location that is being compressed. Of course, there are other diagnoses that can mimic ulnar nerve symptoms too. You'll want to discuss those with your doctor to rule this out before you treat cubital tunnel as such. These can include, but are not limited to, a lung tumor called a Pancoast tumor, problems originating at the neck or shoulder, or even at the wrist, along with other diagnoses that are not covered in this video. Patients should work with their doctor to diagnose where the symptoms are coming from before deciding on an appropriate course of action to take. One of the most common and frequent culprits to symptom aggravation is a side sleeper who sleeps on their side at night with their elbows bent in the fetal position. This position aggravates the ulnar nerve by kinking the hose as it goes around the elbow. The solution to this is to keep your elbow straight at night, whether it be to get a splint or orthotic to keep your elbow straight at night, or just to take a towel, wrap it around your elbow loose enough to where you cannot bend your elbow past 90 degrees. Make the towel loose enough to where it doesn't cause any numbness or tingling in your fingers or any pain in your elbow. The other times that our elbows can be in a hyperflexed position is if we're talking on the phone, if we're on the computer too long, if we're texting a lot, or reading a book close to our face. Anything that you do where your elbow's in a flexed position beyond 60 degrees is something you want to take a good look at to see if that is contributing to your symptoms. I suggest keeping your desk low and your armrests off your chair so you're not tempted to lean right on top of the nerve. Also pay attention to where your monitor is. If you're on a laptop, try raising it up to where your neck doesn't have to look down or up. It can look straight ahead. Adding a separated keyboard would be convenient in this situation. We live in a world and a time where everything that we do is in a terrible posture position. We're either reading, typing, texting, writing, cooking. Everything we do is in this forward hunched position, and nothing we do gets us upright and in good ergonomic proper form. This leads to our pectoralis minor muscles getting shortened and the muscles of our back and shoulders getting more and more weak as the years go by. In order to correct this position or posture, we need to be able to sit up better and hold our shoulders back in good alignment so we can come at desks with a more proper position. Another activity that can be aggravating to the ulnar nerve is direct pressure on the nerve. Most commonly, I see this either resting the elbow on the center console of the car, leaving your arm out the window, or resting on the corner or edge of a desk. You'll also want to avoid repetitive bending and straightening of the elbow, traction on the nerve, or anything that causes numbness or tingling of the small finger ring finger. If you're interested in learning about other video content, such as ergonomics or other hand conditions, please visit my website. I hope you've learned a few things. Until next time, I'm Casey, and this is Hand Coach.